Rampart, this is Medic 4. We are en route to your facility with a 24-year-old male that fell from the roof of a two-story building. Bystanders reported a loss of consciousness for approximately 3 minutes. He has a contusion to the occipital region of his head and tenderness to palpation of his left ribs. No chest wall instability noted. He has no external bleeding or no other major injuries at this time. Currently has a GCS of 12 with eye opening to pain, confused speech, and following commands. His airway is clear and is breathing normally at a rate of 16. Lung sounds are also clear. He has a strong regular radial pulse of 62, blood pressure of 142/82. He has a pulse ox of 94%, end-tidal CO2 of 43, and a sinus rhythm on the monitor. Patient is immobilized to a long backboard. We have him on oxygen and will be to your facility approximately 15 minutes. Go ahead with any questions, comments, or orders.
Copy that, Medic 4. Your interventions sound appropriate. We will activate a trauma response and see you in Trauma 1. The reports I receive from incoming EMS units are vitally important. Keeping them short and to the point is key. The pre-arrival report allows us time to prepare the appropriate room and summon the appropriate staff. Use of a report template, such as the MIST format, will allow you to do just that.
During a 30 to 60 second report, the MIST format includes highlights of the mechanism of injury, briefly describe how the patient was injured, include details about the type of crash or if any weapons were used against the victim. Was there any safety equipment in use that may have lessened the injuries sustained? Be sure to include approximate vehicle speeds for crashes or the distance the patient fell. Report any significant injuries you found in primary or secondary assessments. Consider using the A, B, C, D, E format you used to do the primary survey. You do not need to include all non-life-threatening injuries. Next, describe significant complaints the patient has and the most recent vital signs. The vital signs included may vary by the specifics of the patient's condition, but will generally include GCS, BP, pulse, respirations, lung sounds, and pulse ox. The treatment section should also be brief and include only the care of any life-threatening or major injuries. Also include how the patient responded to those interventions if appropriate. Did assisting ventilations improve his oxygenation? Did direct pressure control the bleeding?
While the pre-arrival report helps us prepare for the patient's arrival, the bedside report gives important details of the incident and patient condition to the hospital personnel that will be taking care of the patient. The MIST or MIST format for pre-arrival and bedside reports can help you provide important details of the patient condition and your care while keeping it short. Our procedure is to give you 30 to 60 seconds to relay important information and details of your assessment and care before we need to begin our own detailed assessment and interventions. We know that other details of the call will be in your patient care report and that we can access that later.
All right. So this is Charlie, 24-year-old male, fell off of a two-story building this afternoon. He landed on a gravel surface. He didn't strike anything else. People on scene advised that he was unconscious for about 3 minutes. Our assessment noted a contusion to the occipital region of his head, tenderness to the palpation of his left ribs. No chest wall instability noted. He has no external bleeding. No other major injuries noted. And we do not know anything about his medical history due to him being unconscious. He maintained a Glasgow of 12 with eye opening to pain, confused speech, and following commands. His airway is clear and is breathing normally at a rate of 16. Lung sounds were also clear. Last blood pressure is 136/78 with a pulse of 72. Pulse ox improved to 95% and his EtCO2 remained between 38 and 43.
All ambulance services in North Central RTAC have been provided copies of a card with the MIST format on one side and hospital phone numbers on the other. Keep this card handy in your ambulance and use it to improve your pre-arrival and bedside reports. Check out ncrtac-wi.org for more details about the North Central Regional Trauma Advisory Council.